Organizations across Kentucky say they are concerned about what the suspension of federal funding for HIV prevention services could mean for communities in our area. They say the decision to cut CDC funding basically puts an end to a goal that President Trump set in his first term, which was to end the HIV epidemic by 2030. Wave News reporter Fernando Garcia-Francescini is joining us now to explain the impact these cuts could have on local groups.
Yeah, Brian, according to the Louisville Pride Foundation, in 2023, more than 40,000 HIV tests were conducted across Kentucky, and they say most of those, more than 37,000 to be exact, were administered through local health departments and community-based organizations like theirs and AVOL Kentucky in Lexington. And with Louisville seeing HIV rates above national average, they say that should be a wake-up call and not a green light for budget cuts.
This is not an issue of waste and abuse. This is an issue of people's health, taking care of them and making sure that they're okay, and don't pass it on to additional partners.
Andrew Shade works at AVOL Kentucky, an organization with a mission to end the stigma surrounding HIV all across Kentucky. He says they found out this week they'd be losing $200,000 in CDC funds.
I think this is a big mistake from the very top. I think it's done in haste and not with a lot of planning or analysis on what this is going to cost us.
Shade says AVOL Kentucky uses the federal funds to make sure people living with the virus have secure housing and to prevent further spread of HIV through education, testing, and counseling.
If we get people tested, if we know their status, if we get them on medications, they stop passing it on to partners. Guess what that does? It ends an epidemic.
In a statement to Wave News, the Louisville Pride Foundation explains its funding is separate from the CDC, but that, quote, any interruption in funding threatens the infrastructure that allows us to offer free testing, education, and referrals to care. Both the Louisville Pride Foundation and AVOL Kentucky saying they don't see these cuts as a smart long-term decision.
This costs money on the back end where you maybe it's not upfront to prevent HIV infection among Kentuckians, but we'll then later have to treat them. So this is not a good financial decision. It is not a good human decision.
AVOL Kentucky says it's already making adjustments to get ready for that lack of federal funds, and those changes include cutting down their HIV testing hours. Fernando Garcia-Francescini, Wave News.
All right.